I'm Sharon Jacob, and welcome to the 7th Annual Village HealthWorks December Luncheon, reimagined this year as a virtual celebration. Thank you all for your continued support and for spending some time with us to celebrate together all that has been accomplished over the last year at Village HealthWorks. I know I'm not alone in expressing that 2020 has been one of the most challenging and difficult years in our lives. I am forever grateful for the silver linings. Our team on the ground has a renewed focus, strength, and dedication. Our mission is to complete the construction of the Kikutu Hospital and the Women's Health Pavilion. We come together to share an incredibly important story of a small, nonprofit, grassroots, community-driven organization in a little-known country called Burundi. Over the last 15 years, Village HealthWorks has established a hub for healthcare, education, food security, and community engagement that will change an entire generation and a country. I'm so pleased to have so many friends returning to support this incredible, important organization, and to welcome all the new and interested friends to this first ever virtual celebration as we eagerly anticipate the opening of the Kikutu Hospital and the life-saving surgeries it'll bring to the community. Please sit back and enjoy this virtual celebration featuring a lively, moderated discussion with our founder, Deogracias Nizonkiza, and Paul Farmer with my good friend, Allie Wentworth. You will also get a sneak peek at the newly constructed hospital with Dr. Tered Magoud, along with many other opportunities to witness our work in Burundi. Enjoy your delivered breakfast or lunch, and thank you again for your generous support. With your help, we are building a community that is strengthening hope, dignity, and resilience.
When you are Burundian, particularly growing in rural area of Burundi, you really don't need to be taught how important healthcare is. You live it, you smell it. You live in conditions where it seems like death is more common than life. I was born in rural Burundi. When I went to school, my first day of class, we had a lot of children packed in a classroom like sardines. By the end of the school year, the classroom was half empty because so many children died from totally preventable diseases. Today, I do not have a friend of childhood alive. Every time someone was being buried next to our school, people would cry family members. And then the teachers will tell us, kneel down and let's pray. That was the medicine. I would ask myself, if I could make it, how could I change these conditions? The war started in Burundi. I ended up in the United States and had $200 US, didn't speak English, and I was on my own. So that's how I ended up being homeless in Central Park. I felt that my pride, my dignity had been destroyed, and I was half alive. I was no longer the person I used to be.
I could see he was so thin, and I could just imagine what he'd been through. I'd seen terrible things on television. I just wanted him to be able to start to breathe deeply and know that he was cared about.
Sharon showed me humanity. She showed me kindness, compassion, that despite everything that had been going on in my life, there were still people out there who cared, and that I should not give up hope in my dream. I went to Columbia University as an undergrad and moved to Boston, where I attended School of Public Health and Dartmouth Medical School. In 2005, I went back to Burundi. I saw for the first time after 11 years, patients dying in horrifying conditions. I knew that Burundi had suffered. I had no idea that patients were dying at home the way they were dying. In hospitals, people were there to watch themselves die, not to be treated. And the conditions they were dying in were so dehumanizing that I couldn't remove these images from my head. I visited all public hospitals in Burundi. Every single hospital I saw was worse than the previous one. And yet I had hoped that maybe the next one would be better. There can't be anything worse than this. But I was wrong. And I got a big picture of what being sick in Burundi meant. I needed to do something about it. That was the beginning of Village Health Works. The vision was to change the healthcare system, to bring decency where it had been lost, to treat patients in a dignified environment, make sure that no mother dies in childbirth again.
I think what drives Deo and what drives all of my clinical colleagues, everybody, is a belief that we can do better, that's not the way things need to be, and moreover, that actually the solutions for this are eminently available, they're doable. Yes, they take will, yes, they take resources, but we can change the story.
The first step was to make sure that every single one in the community who could be available could actually make it happen, participate. Don't sit down and wait for someone to do something for you. And that community was the first greatest philanthropist to rebuilding their own community. They donated the land, they built the road. Every single Friday they would come by hundreds, carrying bricks on their heads, digging stones. They were the transportation system, they were the trucks. They were the one who were feeding us, they were the one with the ropes going around. We didn't have any surveyor. So they really came together to build Village Health Works. We're talking about former enemies who had spent over a decade running away from each other. Now they are friends, they are collaborators. They know what they can do to protect their communities from being destroyed, but also to make it flourish, be a community, a peaceful community, a community that has hope. The trauma of war they were carrying all the time started really healing because they were having constructive conversations. They were not afraid anymore of each other. We started with the health, and every program we started brought a new program. We had a lot of children who came to our clinic suffering from malnutrition. So they needed to eat healthy food. So we introduced food security program. We just opened a boarding school with the idea of creating an education based on critical thinking so that we can have future leaders who are able to think. It's this really beautiful, holistic approach that is embedded in the community and through Village Health Works. It's really a place of hope and growth and peace. We've been a primary care health center. Now we are moving to becoming a teaching hospital. We call it the Women's Health Pavilion and the Kigutu Hospital. It's a 150-bed hospital, 85,000 square feet. It's going to offer pediatric care, surgery, primary care, but also help healthcare professionals, medical students in the country to come and learn and improve the skills they have and they needed to take care of patients.
What is unique about this place is that you can see single private delivery rooms for each patient. So this whole block here is basically from that moment, from there onwards, for training and research. The idea is a humane hospital for human beings. People are dying right now in childbirth. Many people die here for, well, no good reason, really. Preventable deaths. Building something like this will have two effects. It will make a contribution, but it also highlights the scale of the problem. And hopefully it will also inspire other people to do similar things.
We started with a little clinic, and now we are evolving to becoming a center of excellence. It's community building. it's peace building, it's providing healthcare, system, the quality of education. So it's life and livelihood. So it's really something that needs to continue to grow and shine hope, not just in that community, but beyond that, and show that indeed where there's health, there's hope.
Now I'm excited to introduce the speakers of our panel discussion. Joining Deo today is Dr. Paul Farmer, Village HealthWorks board member and founder of Partners in Health. Their long friendship is rooted in their shared mission to deliver healthcare and hope to the most vulnerable. The conversation today is moderated by my friend, the hilarious and caring Allie Wentworth.
Hello, I'm Allie Wentworth, and I'm so honored to be here talking to Deo and Paul Farmer on behalf of the Village HealthWorks. And it is not lost on all of us the irony that we are in a global pandemic right now. One of the things, Paul, in the Netflix special, Bending the Arc, was a woman who was saying, rich or poor, we have the same blood. So here we are, COVID-19. So first of all, you guys are very good friends. Aren't you brothers from another mother, as they say?
We definitely are. And we also think of our families as family. So it's not just the two of us.
And you met at Harvard. Can you tell me about the genesis of this incredible friendship?
I remember very well the day that I met Deo. He came to a class that I was giving at Harvard School of Public Health. And, we just started talking, and that conversation has now gone on for a couple decades. Obviously, it's involved, a lot of time together, working together in the United States, in Rwanda, in Burundi, of course. But, Deo's been to Haiti, knows the work that we're doing, and we've all been to Burundi, and our lives are intertwined in that way. It's been a very vibrant friendship.
I remember, Paul, that very same day we met, and I really felt that this person we met before in our previous lives, and it was such an uplifting moment for me when we met, to actually see someone who even understand where I was born, the conditions, what I went through, the wars and the kind of stuff, without having to ask, oh, really? Is there a country, Burundi? Oh, wow. Stuff like that.
For someone like me who took my daughter to Burundi, having been there and seeing how incredible the Village HealthWorks is, it's a struggle for me because I'm always trying to describe what all of you have created there. Obviously, when you get to actually smell it and feel it and see it and talk to the people, you get a much better example. But yes, the holistic model that the Village HealthWorks implements in Burundi is unusual nowadays because it's a specific, scalable, technology-based solutions. Those are the things that are so sexy and popular right now.
So you open a health center and you have patients coming to get treated. So you really have to dig and look into the root causes of the problems. For example, a country of farmers, a country where you can grow anything really you want, but you have 58% of the children in Burundi are suffering from malnutrition, and it's because of a lot of problems. So we kept integrating every program into our health program, and food, as Paul Farmer would tell you and has said that many times, food is a medicine. And really creating a space for people to have a conversation, do home visit with our community health workers to see exactly the living conditions they are in. So you can't really just do one thing in a poor resource setting like Burundi or Rwanda where PIH is, or even Haiti and can't, and then say, oh, I am just doing enough, and this is what is important.
When you show up, in the middle of a clinical desert, like Kigutu prior to Village HealthWorks, people just have every kind of problem that you can imagine. Yeah, they're sick, but they're also hungry. They sustain injuries. And some of these illnesses, of course, are catastrophic illnesses and injuries, cancer, obstructed labor, AIDS, TB. But a majority of them are underpinned by poor nutrition. So, what should Village Healthworks do? Do you just shrug and say, hey, we're a medical organization? Or do you design the organization to respond to the needs of the population you're serving? And Village Healthworks has chosen the latter.
Right.
And that's really Deo pushing forward a much more ambitious agenda than you're going to see in lots of parts of rural Africa.
One of the primary obstacles for Village Healthworks, there is the difficulty of delivering healthcare, and then there's a whole other mountain to climb with attracting donor dollars. How do you get people to think on a much bigger and global level when they think about healthcare?
Health is a sacred, and public health, medicine as such, healthcare system should be sacred. And we should really be able to invest as much as we can to make sure that no mother dies in childbirth in the 21st century.
Deo, how important is the teaching aspect of the new Kigutu Hospital?
So we really wanted to make sure that healthcare service is also going to train the future leaders in healthcare and and share the knowledge, not just where we are, but across Burundi. Go to other hospitals, public hospitals, and provide the quality of care, improve the quality of care in those hospitals and health centers.
The tasks of the teaching hospital are to teach, to do research, to generate new knowledge, and to provide care for patients. Everywhere that mission is followed, the quality of care tends to go up. And that's in large part, we believe, because of young people asking questions, participating, in other words, being trainees in a teaching hospital.
If there's one thing that we know for sure, it's the end of this life. And we don't want to take our knowledge into the grave. You need to leave that knowledge with others in the future generations who will learn and transfer the knowledge to other people and keep really expanding. That is the really goal for this hospital, to improve the quality of care in Burundi and also train young minds so that they can continue the mission, the vision, and improve to help those poor people who are neglected.
This is meant to be a world-class teaching facility that happens to be in rural Burundi. This is the epicenter and the home base of what will be a very large and influential program to address health disparities in Burundi and the region.
Exactly, yes. The government gave us a catchment area of 200,000 people today, but we see people crossing the Lake Tanganyika from Congo with the canoes. We see people coming from neighboring countries in Tanzania from Goma. So as Paul said, our doors are open for every human being who needs help, and we can help.
Right now, our whole world is in crisis, and it's very hard for people to be optimistic. Tell us how you are being so optimistic about the future of the Village Healthworks and what you can do in the future to provide healthcare for all these people.
Anybody who's been to Kigutu before there was even electricity or a safe water supply can't help but feel optimistic looking at how far things have come now. Even without the hospital completed, Village Healthworks is an epicenter of goodness and healing that reaches a very large area. When you invest substantial resources, including your own energy and passion, when you do that over time in this arena, people are optimistic because they see improvement. To get optimistic, get involved.
We find hope that keeps us going. It becomes this really honor to serve.
I want to thank you, Deo and Paul Farmer, for talking today, for being the incredible human beings that you are. And I hope that more and more people will support all of these efforts and give to the Village Healthworks. So thank you.
Amen.
It's hard for me to have a peace of mind when I see people struggling, suffering from something that we can prevent or we can solve. Cecile is one of the very proud mothers around here. Unfortunately, she has a very sad story, which is the loss of her sister. She was determined to make sure that she would raise her children, send them to school, feed them the right food, but now she has to feed two families. Her sister was pregnant and tried to deliver at home. She's pretty far away from here. She came here with our ambulance, but when the doctors were looking at her, she's in labor, they realized that she couldn't deliver without having C-section. The baby was dead. And then when the doctor tried to save the mother's life, the mother didn't wake up. So her story is very sad. The way she put it, the next morning she went to the market and bought 2 coffins and brought her sister and the baby to bury them around here. Now she's in charge of the children left by her sister and her own children. What happens when a mother dies? What happens to the children? What happens to those who are staying behind? It is all devastating, and it is society's fault. It's not Cecile's sister's fault or anyone's fault. It's us. And we turn our ears deaf and our eyes blind, and that's not acceptable.
Hi everyone, I'm Allie. This is George Stephanopoulos and Elliot, and we're so grateful to be here supporting the Village Healthworks. Elliot, why don't you tell us how you introduced us to it?
I first heard about Village Healthworks when Deo came and did a presentation at my school. I'm close friends with Cece Jacob, who also introduced me, and after that presentation I was really moved and I wanted to participate, and that's when I came to my parents to tell them about Village Healthworks. And then we went to Burundi.
We had an amazing trip to Burundi. Deo gave us a tour. We met a lot of the villagers. We met some of the doctors. We met Tariq, who's this incredible OBGYN surgeon from Egypt. And we realized what they're doing there is incredible and also such a blueprint for the world in terms of how you can create a community where you have medical help, you have food sustainability, and how they're all interconnected together. We were just blown away.
In a word, Deo is revolutionizing how healthcare is provided to the most needy people in the world and how it can become self-sustaining over time. And that's why we're so proud to help Village Healthworks. We hope you do too.
Hi guys, hello from Germany. I founded the Tony Garn Foundation around 5 years ago, and we support girls in Africa to enable them to a good quality education and to enable them to graduate, to enable them to get to school. And one of my most incredible, most professional projects by far is Village Healthworks. We also work in Uganda, Rwanda, and Ghana. But Burundi, our project in Burundi is just such a incredible blueprint for how health and education go intertwined, and I would love to actually be able to bring the other headmasters, the other project managers from my other countries to Burundi to really see this is how it's done, because everyone has to work together like this. The community has to be on board. Locals have to want to support, have to understand what's going on, and that's why Village Healthworks is so unique and so special, because they're just so sustainable. The way they work, every dollar really gets turned around in the most incredible way, and they're fast the way they build. Their education plan is on point. I've supported KIA now for the last year, and I'm so excited to see what else is happening. I'm so excited to see the hospital finally finished. So I will always support Village Healthworks. I absolutely love the organization. I was lucky to go this year, and I really hope I get to go soon. Please support them. They need your help, and they will really do the most with your money. The most that can be done in development, Dio is doing with Village Healthworks in the most sustainable, incredible, professional way. So please support, and thank you for listening, and Merry Christmas.
Today, I really feel that Village Healthworks is entering what's almost the third chapter of our story. I think the first chapter was really captured by Tracy Kidder's book that profiled Deo, about his growing up and his escape and the beginnings of his return. I think the last 15 years have been the second chapter, where we've ended up building a clinic that now sees 50,000 patients a year. We have our school work, we have the early childhood development program, we have food security programs, we have economic development programs, we have this very rich music and arts and drumming programming on campus. What we need now is a third phase, where we take the foundation that we've built with our primary care work and with our community health work, and we add really robust inpatient capacity. And that means surgical capacity, so we can be doing C-sections for the women who need them. That means general surgery, and very importantly, that means building out our teaching and our research, so that we're asking important clinical questions, where we're piloting new systems for health delivery, and learning as we go and sharing what we learn. So the next goal is really to open the Kigutu Hospital and Women's Health Pavilion on schedule next year, that we get the right team in place, providing high-level care and care that really holds the patients themselves at the center of everything we do, patient-centered, dignified healthcare. To get there, what we need is to expand this community of people who have joined us along this journey, who believe that the work we're doing is important, who believe that women should be able to predictably survive childbirth. Again, this is not clinically difficult medicine. Really, it's a question of will, it's a question of resources, and it's a question of enough people caring and thinking that this is an important thing to do. What's remarkable is that it actually doesn't take that much to accomplish this. For $1,500, you can fund a nurse's salary for 6 months. For $2,500, you can fund the neonatal equipment that will be used over and over again to save babies' lives. We're working in a place where a dollar really stretches a very, very long ways in terms of its impact and its ability to save lives and to create a center that has ripple effects well beyond its geographical area. Please give to Village Healthworks today, because you can save a life and you can support the people who are saving lives every day.
Women Health Pavilion is more important than I can even have the words to explain that in my poor English. Everyone is eager to know really how, when Village Healthworks Women Health Pavilion will open its doors.
Très propre, avec beaucoup de services. Reviendront nombreuses.
Iyo hopitale niyo yahera ikizondorohera, urabona badupfunye urugendo iyo twara twivuza kure, ikikirizo nta kintu bashobora kuriha bishobotse ingwara bakayitora.
Hagabanuka umurindi wo gutora abantu kuma tubajyana i Bujumbura n'ahandi hose, ko bizoba byagutse, bizoba ari binini.
Il n'y a pas d'autre hôpital d'une même envergure où on peut donner des soins de qualité. Mais également, vu la capacité d'accueil qu'aura cet hôpital, nous pourrons servir une plus grande population et surtout les femmes, bien sûr. Merci.
It will help many people to promote their health, and especially for women who will deliver with dignity in special rooms.
nk'abarwaye amaso nabo bazokuvuriza hafi kandi zabatomboye zabafise abaganga benshi bakwiye
ashobora kwivuza hafi yiwe kuko uburyo hari abo usanga bugoye ugasanga bamurungitseho mu bindi bihugu ugasanga biramugora rero ibitaro ni nkenerwa mu gihe bibaye hafi yacu amagara yacu acakurikiranirwa hafi gusumba
yibaruke neza kamugirira nka kare bahora bagenda ku bitaro mu yandi makomine ariko ubu byofashije ngaho iwacu Ikigutu.
Akamaro bizobagirira nk'abajya abavyeyi bibungenze ntibaro bakigenda kuvurirwa i Bururi mu za Bujumbura mu za Rumonge kubagwa baruca babagirwa ngaha.
To have access to health care, a decent health care, that will have a significant impact on the economy. I'm not talking about just the national economy, but a local-based economy, because healthy people can deliver great things, can deliver great results. So this is how I see, or I think will happen once we have this hospital finished.
tukifuza ko abavyeyi bovyara mu mutekano ntangere nuko kugira amagara y'abantu agende neza cyane.
Ni ukuvuga iyo hopitale izoyorohereza abanyagihugu kuja ku yandi mahopitale nk'abakunda kino kigo bazoba batakija kure bazoba baja hafi.
Thank you all so much for coming this afternoon, and I hope you've enjoyed our program. Please keep Village HealthWorks in your thoughts and prayers, and we hope you have a healthy, safe, and happy holiday season.